The program is easy access to healthcare for all, a program which brings you news and issues around the national health insurance ecosystem and the effort of the National Health Insurance Authority as it drives Nigeria towards universal health coverage. One major strategy employed by the present leadership of the National Health Insurance Authority to help it fulfill the mandate of the scheme is capacity building. To this end, it has organized a series of trainings for members of its management team, for staff, and for stakeholders who are key players in the health insurance space. Recently, it organized an NHIA leadership development program for CEOs of state social health insurance agencies in Lagos. The training is geared towards repositioning the health insurance space towards the attainment of universal health coverage and fostering better leadership among stakeholders. I am your regular anchor, Aisha Mohammed Ahmed, urging you to stay tuned. I'll be back shortly with details of this event and more.
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
NHIA. First on the program is a highlight of event around the NHIA. In the news, NHIA receives a team from Roche. Discussions bordered on the implementation of the partnership between Roche and the authority as regards cancer drugs. Details of these and more coming up shortly.
The National Health Insurance Authority, on Friday the 17th June 2022, laid host to a team from Roche. The team was led by Dr. Ladi Hamid, the country director of the company. You will recall that in November 2021, Roche signed an MOU with the then National Health Insurance Scheme to subsidize cancer medications to health insurance enrollees. The purpose of the visit was to congratulate the authority on the signing of the new NHIA Act into law and to reaffirm its partnership. The meeting was also to draw up a framework for the implementation of the MOU in the pilot centers.
Our current MOU, how do we ensure that with the cost-sharing model we've put in place, that it begins to touch, I think incidentally, even the First Lady mentioned and acknowledged this partnership, and her ask for us was to ensure that it touches the last mile patients.
While responding, DG NHIA Professor Sambo appreciated Roche for its partnership and support towards the health sector.
We also want to acknowledge our appreciation with the MOU that we have signed with Roche in the area of reducing the cost of cancer drug. I want to tell Roche the entire system is overwhelmed with that arrangement that we have embarked upon. People were calling us to know more about that collaboration, and people are seeking for information. So we really appreciate that. That's a collaboration that will go a long way in deepening the relationship between NHIA and Roche.
The NHIA organized a two-day workshop in the Lagos zone to bring both NHIA and the NYC state and zonal coordinators, as well as the 6 health maintenance organizations together to learn the operational modalities of Gift Ship N. This is to help boost its implementation in the various states. The Gift Ship N program is designed to provide health insurance cover so that all serving corps members can have access to adequate and quality healthcare services. Dr. Eke Jonathan, who gave the opening remarks, said the workshop was necessary to help educate implementers, having in mind that the program is a new one.
I think we are very, very happy to have all of us here gathered to see how we can make the running of the NYSCG better to serve the corpus or the core members. They say we don't call them corpus, we serve the core members. The program started effectively on the 1st of March, and as all of you are aware, as the implementing partners and implementing structures of the schemes, we realized a lot of challenges came up at the early stage of the implementation. And a lot of these challenges we noted are due to some gaps.
Co-chair of the Joint Implementation Committee for the gift ship and also gave a welcome address, during which he highlighted activities that preceded the signing of the MOU up to its implementation. He urged players to give in their best.
Other activities included nationwide sensitization of serving core members, the continuous camp sensitization and monitoring of program implementation in all orientation camps nationwide. Also, there was an on-the-spot assessment of policy implementation at some camps that had challenges of takeoff. Today, we are witnessing the second edition of training workshop for field officers for both schemes for the southern states. All these efforts are geared towards smooth takeoff and proper administration of a comprehensive health insurance policy for core members that will promptly address their health needs.
Participants shared their thoughts on the program.
Yeah, it's a laudable program, very educative and interactive. It's all about NHIs interacting with NYSC as a government enterprise. It's an exchange of ideas on how to run the programs and for the benefit of all.
This program is an important program. It is crucial in the sense that it will enlighten both parties and other stakeholders on the responsibilities and on all that it takes to ensure that this program of health insurance package for the core members are understood for better implementation.
The program is easy access to healthcare for all. With the passage of the National Health Insurance Authority Act, the need for capacity building has only just intensified. Everyone involved in the march towards universal health coverage needs to come on board to understand how the new act will affect implementation. Recently, the NHIA brought together CEOs of state insurance agencies for a capacity building session. Highlights of the topics and sessions during the 3-day event make up our issues around the NHIA. Let's get details of how it went in our next segment. Please don't go away.
Easy access to quality healthcare for all. NHIS.
When Professor Nasir Sambo assumed office as the head of the National Health Insurance Scheme, now Authority, he unveiled a 3-point rebranding agenda, which involves restoring value systems that will transform NHIS into a credible result-driven organization, engendering transparency and accountability in the entire operation of the scheme, accelerating the drive towards achieving access to quality healthcare for Nigerians. The management of the NHIA has continued to operationalize this agenda to help it fulfill its mandate. It is in this light that the authority keeps organizing a series of trainings that will help in the achievement of this 3-point agenda. These trainings are geared towards building capacity of personnel and stakeholders, and also repositioning the health insurance space towards achieving universal health coverage. One of the recently held trainings was that of the CEOs of the state health insurance agencies across the country. The event, tagged NHIA's Leadership Development Program, NLDP, held at the Enterprise Development Center of the Lagos Business School, Lagos. Result for Development, an international organization, facilitated the training. The event started with a welcome address by Professor Narcis Sambo, who was represented by Lagos State Zonal Coordinator Oluwafemi Akimbade. While speaking, he said the workshop is to help foster better leadership and urge participants to be open-minded and maximize the opportunities.
A lot of us seated here have gone for so many leadership trainings around the world, not even the country. But this might be like a refresher course for us. And just like Dr. Hope said, let's open up our minds. The whole idea of this is to foster better leadership, even in our organizations, not only to talk about the country. So a lot of things are going to be taken away in these 3 days. We all know that you are busy executives, and the 3 days is like taking away a whole world from you. But please, we want to employ that you just pardon us. It's going to be an eventful 3 days, and I'm sure that in the course of that 3 days, you will pick up some things to refresh your mind also about what we are trying to achieve by this training.
Dr. Hope Uweja, Country Director of Result for Development, R4D, in his opening remarks, said this workshop is geared towards capacity building of not only the staff of the scheme, but key players also, to enable them fit into the new NHIA.
More importantly, what is this program all about? One of the lessons I learned from my experience both in the development world and in the public sector was that as we grow up, we become so technical that we end up in the technical milieu and forget that there are other areas that will impact and will determine whether we'll really be successful in the core mission of our organizations. So as when we were interacting with the National Health Insurance Scheme as it then was, they came out and said they wanted the capacity of both their middle and senior level staff and that of the state schemes to be built up in anticipation of the newly established authority. So what you have here, the NHIS Leadership Development Program, is an attempt by the consortium comprising the donor, the authority, and R4D to say, how do we build the capacity of these agencies?
The event was packed with several training classes, interactive and breakout sessions. It commenced with a presentation tagged Leadership for Change by Dr. Adedamola Dada, who spoke extensively on different aspects such as change management.
We prepared the organization for change, okay? And to prepare the organization means that even you must exude that change. You know, you must be prepared to engage. You must have a clear vision. You can't sell, you can't build something on nothing. You can't sell what you don't know. So you yourself must have a clear understanding and a clear direction of where you are going. The blind can never lead the blind. Okay? So you must be clear in your mind about what your vision is. All right? And then you must be able to break it into languages or mechanisms by which, you know, that your followers will understand. Okay? And so sometimes you have all these strategic plans that people prepare. Even for those who are at very high distance, it's difficult for them to understand. When you have that kind of strategic plan, it's a panacea for failure. It's not likely you're going to succeed. You must prepare your plan so that those who are following you can understand. They can share it.
This class was followed by another class on critical thinking and team activity, taken by Ekaete Augustine Edet.
If you're not aware of yourself, your value system, your ethics, your beliefs, if you don't know who you are, the things that control you, it can be very difficult for you to be open-minded enough to practice critical thinking. If not, because why? That was your values, your ethics will always be a stumbling block. I can come to you and say, technology is the next thing to go. But because maybe you heard something, remember when the COVID vaccines were coming out? Did you hear the stories with the COVID vaccine?
Some of the other topics treated include the concept of a team, the team building process, characteristics of effective teams, and stages of team building by Kaete Augustine Edet, succession plan, performance management for corporate excellence, leadership and leadership styles, change management, and emotional intelligence, EQ, and several other topics treated in breakout sessions. Participants shared their thoughts on the workshop.
We have learned a lot of things, especially when it comes to leadership, the leadership styles, the management, specifically management by objectives. So when we get back to our respective agencies, we are expected to improve the capacity of our staff, extend these leadership strategies to our respective departments so that they can emulate and use such on their subjects so that they can effectively manage the agencies we have there, and also to, as I said earlier, to achieve the universal health coverage.
I've been receiving a lot of lectures about how to critically think out solutions to a lot of our problems in our workplaces, and we are hoping that by the end of this whole training we'll be able to handle change in our institution, in our different places of work, and in how we also manage individuals. So for what I've seen this morning, I have a great expectation that at the end of this program, we're going to be different crop of CEOs.
Welcome back. Healthcare providers play an integral part in the health insurance space. They interface directly with enrollees in the course of giving them health care. One of such healthcare providers is Giwa Hospital in Kaduna. We had a chat with Dr. Olushola Falaye, Medical Director of the hospital. He gives us a brief history of Giwa Hospital, Kaduna.
Giwa Hospital is a multi-specialty hospital founded over 20 years ago and providing service, healthcare delivery service to Kaduna people and beyond. In those years, multi-specialty, we are mainly into primary and secondary care.
He says the impact of the NHIA in Nigeria has helped many Nigerians access quality health care.
There is no gainsaying the fact that the NHIA has really helped to improve healthcare delivery to Nigerian populace. Since its inception, a lot of people have had surgeries, have had deliveries, have been able to access normal healthcare that otherwise, probably, if not for the scheme, they probably have gone to chemists, gone to any ramshackle, all this under the house. But with the coming of NHIS, at least they've been able to access standard care in standard hospitals.
Dr. Olushola says the National Health Insurance Authority has also helped improve funding for their hospital.
Yes, I will say yes, because I know how this hospital was from the onset. It started as a one bungalow hospital, and over the years, with some of the fund, I won't say all, at least with some of the fund coming in from the National Insurance Scheme, they've been able to put on more structure, able to improve the infrastructure, the equipment, and the rest. It has been really helpful to the hospital as a whole.
Dr. Olushola shares his challenges with health maintenance organizations in the course of providing healthcare services.
Ideally, if you are in a very good situation, we are supposed to be collaborating with the HMOs. They are the one sending patients to us, and we are the one rendering the service. But from our own experience, most of the time, we finish rendering these services, And now to get your payment has always been an issue with HMOs. In fact, that's always been the area of a challenge between the providers and because the issue is they are not always prepared to pay what you have for what you have rendered, what service you have rendered, and there's a time they should do it. That's always the major problem.
He also calls on the scheme to look into its business processes as it concerns the fee for service.
If you look at the rate of inflation, definitely, we know it's a pooled fund we are talking about under the scheme, but at the same time, cost of many things have gone up. Cost of consumables, cost of drugs, cost of virtually everything, even power, not to talk of labor. So most of the hospitals, they are just managing, barely surviving. That is the truth. We are barely surviving. So it would be good if they should look and review the capitation, because 750. Many of these patients are accessed care virtually on a daily basis. Because why you can break even is when all of them are not accessing care at the same time. But if majority of them are accessing care, the capitation will not go anywhere.
That was Dr. Olushola Falaye, Medical Director, Giwa Hospital, Kaduna, sharing his thoughts on the operations of health insurance in Nigeria. We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
Question: why do enrollees think NHIS drugs are substandard?
It's a perception issue. And if you really want to answer that question, you need to do some historical background to our health perception of drugs in Nigeria generally, not under NHIS alone, where people perceive that branded drugs are the original drugs. So the term generic it doesn't connote inferiority. It doesn't connote substandard drugs. It does not connote fake drugs. Rather, it talks about the pharmaceutical elements that are actually necessary for drugs are present in that particular drug. For example, a company can brand a drug, can through innovation bring out a drug, and because of what they have spent in creating that drug, the systems allow them to keep patency for a certain number of years, which means other companies cannot manufacture that drugs. But once that period is over, other companies can now come in and manufacture the same drug, the same standard, the same quality.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this week's episode of the program. NHIA, now a full-fledged authority, is leaving no stone unturned to see that it fulfills its mandates to Nigerians. Join us every week as we continue to bring you updates on more of its activities and strategies as it marches towards universal health coverage. See you next week.